Hello, welcome to From Vision to Impact, the podcast where we uncover the bold stories, people, and ideas driving IHM's journey. My name is Sitna, and I am your host. In this episode, we sit down with Mr. Patrick Shabangu, Project Director of the Strengthening Capacity for Health Information Systems Sustainably, otherwise known as SCHISS. From laying the foundations of a sustainable health information system to advancing digital innovations like interoperability, data analytics, artificial intelligence, and machine learning, Pat, as we IHMers fondly call him, shares insights on how SCHISS is driving lasting impact in Zambia's health sector.
So let's start from the beginning. Can you walk us through how the SCHISS project came about and the key challenges it set out to address?
SCHISS project, underlying SCHISS, it's an acronym. Otherwise, the project aims to strengthen capacity in health information system in a sustainable manner, sustainably, hence SCHISS. And the capacity is expected to be built within the Ministry of Health. The question of how the project came about, we were coming from a situation where there were challenges in terms of silo systems, that's one. Two, systems that were comprehensive in terms of covering services, health services, and also poor data quality, and therefore poor decision making. Hence, SCHISS was introduced with support from CDC in 2021.
Well, so the project emphasizes strengthening capacity sustainably. Why was sustainability such a core principle from the start?
I think the aim was to really make sure that this time around, we take this project to relevance. When I say we take this project to relevance, it needs to be handed over to the ministry and be sustained moving forward. The challenges of having projects funded through donors, and then when external funders exit, they then become white elephant. Hence the emphasis on sustainability from the beginning.
Interesting. So what role did data play in shaping the initial vision and priorities for SCHISS?
For instance, as a health informatician myself, but generally health informatics systems, they exist to support either one, clinical practice, two, patient care, three, quality of care, and four, public health programming, but also public health policy formulation. And therefore, to support all those interventions that I've outlined, you need data. You need to generate insight to drive all those things. And so data was at the core of this project. It remains at the core of this project. Ultimately, is the final product for any health informatics system. If it is relevant, it needs to support healthcare services.
Great. So what were some of the foundational decisions that helped anchor the project?
And so having highlighted the point of departure or the gaps that were in existence, critical decisions were made. And these are the decisions that were driving the strategic direction of the project. If you have noticed, the project has three strategic areas. The relevant strategic areas at the time was to say, we do have a smart care system, introduced in 2003, but we are at a point where we need to evolve and scale up the system. That was the first decision that was made. The second one was to say, coming from your previous question, At the end of the day, what do we want to get? So we want to have data that can inform decision and improve health programming. And lastly, once we have a functional system, or even subsystems, because there's also a data warehouse in this picture, we then transition these systems to the ministry. They should be able to administer them. They should be able to manage them. They should have a health informatics workforce that are capable to handle this system moving forward, hence sustainability. So those were the critical decisions that were made at the point to drive the project.
Okay, we've looked at the beginning, and now we're going to look at where we are now. And the first question would be, SCHISS has strategies around digitizing health interactions, supporting interoperability, and advancing data analytics. Where would you say we've made the most impact so far?
Let me start by citing a philosopher, Emerson, Waldo Emerson, where he says, do not take a path that is leading, but rather go for a path that is not even there, but you leave a trail, right? Underline, you leave a trail. And that's what we have done with this project, just to emphasize the issue of impact. So for instance, for this project, we were set to scale up the system into above 1,100 facilities. But as we speak today, we are in 1,615 facilities running the system nationwide, across the country. It's not a situation where it's a system within province or what, it's a national system and is present in the whole country. Secondly, you ask about the impact we have made in terms of the data. For instance, even the concept of data pipeline, it was not there. I'm not boasting or bragging. It was not there at the time. But we have managed to introduce a national data pipeline architecture that is actually working. So we're able to stream data from different source systems. For instance, from SmartCare Pro itself, from COVID data, maternal and child health data, NCDs. We are now moving into malaria, TB, And so we have moved in that aspect, not only to have an optimal pipeline, but to produce visuals. We have our operational visuals that are driving ops for the project. We also have programmatic dashboard. We have executive dashboards that we developed and are actually functional and are responding to the public health strategy for Zambia. And lastly, we crafted documents about this project. And these are documents including frameworks, including SOPs, guidelines, you name them. These documents are ready to be transitioned to the ministry so that they make sure that as they move forward, there is fidelity and adherence to the standards and framework for health informatics moving forward. So for me, those are the impact areas coming from this project.
How has SCHISS supported the Ministry of Health and implementing partners in scaling and maintaining health information systems?
So for instance, the systems I'm talking about, these are national systems. These are not institutional subsystems. These are national systems within the broader enterprise architecture or national digital health ecosystem, if you like. And therefore, they are supporting one, healthcare providers to drive clinical practice. As we speak, we know there are clinical practice reports that are generated and produced through this project. There are national programmatic reports that are generated from the smart care data. There is also insights generated from the smart care data to support decision making within PEPFAR itself. I mean, even at HQ level through the PORT platform. So that's how the data that we are getting from these systems are actually supporting public health personnel, clinical practice personnel, and even programmatic people. When we contextualize the strategy for this project, we emphasize the fact that unlike before, where such systems were developed just to support reporting, even reporting from external partners and even international, development goals. This time around, the priority is that we want to develop a system that will support first clinical practice and workflow and optimize workflow at clinical level. And so it was driven by a patient-centered and provider-centered approach, if I may say.